Hi, this video is going to explain the basics of ultrasound, what it is, and how you use it. I'm Eric Romero for Kane University Athletic Training. Let's begin. So, what is ultrasound? The easy answer is sound waves, or acoustic mechanical vibrations. Where do they come from? How do they move? The waves are transmitted by a transducer, which is attached to an ultrasound machine. In the transducer head, there is a crystal. Here, the piezoelectric effect will convert electrical energy to acoustic energy. An electric current will make the crystal expand and contract at such a rate that it begins to vibrate and form mechanical waves. But these waves can't travel through space like electromagnetic energy. Instead, it relies on absorption and molecular collision. So what's that? The waves traveling and being transmitted through the tissue will cause vibrations on a molecular level. So all these tightly packed molecules you're made up of will begin to move around due to the vibrations and begin to crash into one another. At a high enough intensity, these collisions will produce heat. The human body, like an onion, has layers, from the skin to fat, muscle, and bone. Ultrasound can reach deep enough to get to them all, to an extent. Frequency will determine the depth of penetration, so let's talk about that. Because ultrasound can get through all those layers, it's considered a deep reading modality. Now, this is a wave. The distance between two peaks is a wavelength, and that distance is directly related to the time or frequency between them. These two have an inverse relationship. If one goes up, the other goes down, always moving at a constant. That constant is the speed of sound. With a longer wavelength and a lower frequency, the effects will reach deeper, but overall intensity will be lower. With a shorter wavelength and a higher frequency, the effects will be much more powerful while sacrificing depth. Prolonged exposure may cause tissue damage, so always remember to move the transducer head. When these sound waves are absorbed into the tissue, the physiological effects that occur are separated into thermal and non-thermal effects. Some thermal effects include an increase in tissue temperature, an increase in local metabolism, and vasodilation of arterioles and capillaries. Some non-thermal effects include cavitation, fluid movement, and an increase in cell permeability. Indications to use ultrasound include the following. At any time, you may pause the video if you'd like to take a second to write these down. Contraindications against include the following. I'll take time now to begin talking about patient positioning. Be sure the athlete is seated or laying in a comfortable position. This will depend on the area you're working on. You'll explain to the athlete they may feel nothing at all or a slight warm sensation. But just because they don't feel much doesn't mean it's not working. Be sure to place a towel under the area for easier cleanup. Turn the machine on, and once the machine is on, you will set the parameters. These include treatment time, intensity, watts, transducer size, frequency, and duty cycle. The duty cycle refers to either a continuous treatment or a pulse one with pauses in between. The longer the pause, the lower the overall energy output will be throughout the treatment. Today, we'll be doing a continuous treatment, so it will stay at 100. Remember to keep the intensity at 0 until treatment starts. Apply the gel or medication to act as a medium for the waves to pass through the region. This is the brand of gel we're using. Place the transducer head on the patient and start treatment. Be sure to always move the transducer head in small circular motions along the area you wish to be affected. Remind the patient if they are ever uncomfortable throughout the treatment to let you know. Intensity may be raised in accordance to how fast you want effects to appear. Turn the intensity back down and then stop the treatment. When the treatment's done, be sure to wipe the athlete off. Then you can take time to check the skin. Make sure the transducer head is clean. Do any therapeutic exercises you might need to do, and ask the athlete how they feel.